They've had several tests and all the tests are fine, but they are still not getting pregnant. So unexplained infertility itself is also an indication for IVF.
This question says, what is IVF? For somebody listening to us right now does not really understand what IVF means, please help us break IVF down.
Okay, it's a pretty simple definition. IVF means in vitro fertilization. When fertilization occurs outside of the body, that's simply what it means. So, for a woman to get pregnant, she'll have sexual intercourse. The sperm will be deposited in her vagina. It will swim up through the cervix, the well, through the fallopian tubes, and then go to meet with the egg that has been released by the ovary. That fertilization occurs inside the body. But when we have that process of the sperm meeting the egg outside of the body, then we call it in vitro fertilization. That's simply what it is.
Um, People will be wondering, okay, what is the reason? Why should I go for IVF? Why should an individual want to have fertilization outside of a human body? Meaning that, why should we be talking about IVF today, man?
Okay, so you know, getting pregnant is easy for some people. For other people, it's not as easy and it's not as simple. Some of them may already have reasons why getting pregnant naturally by themselves is difficult. um, Things like previous disease, cancer diagnosis, and treatment, uh, even congenital, the way some people are born. Some people are born without a womb, without a uterus, but they have their ovaries. That's something we call the Mullerian agenesis spectrum. So there people have different reasons why they would need assistance. So the what science does is to be able to offer assistance to people who the sperm and the egg cannot meet within the body. And then science is able to do that in a lab and then be able to have that embryo. That's the potential human being. All of us started as embryos. So the potential human being reaches embryo and then to put it back into a womb. So science just bypasses what the natural process would have done. So
Mm.
yeah.
Now, Mad, I don't know if this question is linked to the last one I just asked. Maybe you will help us. Who is qualified to go for IVF? A woman just says, I can't get pregnant, therefore I want to go for IVF. Can anybody just wake up and say, oh, this IVF looks very interesting. I like the language. I want to go for it. Or someone has to meet a certain criteria or qualify for IVF.
So yes, someone has to have, we call it an indication, a reason. So that person would have, seen a doctor and they would have had a diagnosis of infertility. That means they've been having regular unprotected sexual intercourse for 12 months and they haven't been able to achieve pregnancy. So when they've done all that, or even for some women, we use 6 months, especially when there is an indication that warrants an earlier intervention. So, for example, let's say one of the couple has had maybe cancer in the past and they've had to have chemotherapy. They already have an indication. We are not going to be waiting another 1 year after they get married because we know that there's a reason why these people may struggle to get pregnant. So there has to be a reason why IVF, because it's not like Panadol. You just go to the pharmacy and say, give me Panadol over and they give you. Yeah. So there has to be an indication. The reason why the pregnancy hasn't come about naturally would have been evaluated. Is it from the male side? Is it from the female side? Is it a combination of both? Because there are couples who have a combination of both factors. And then is it that it's even unexplained? They've had several tests and all the tests are fine, but they are still not getting pregnant. So unexplained infertility itself is also an indication for IVF. For some people, it may be that there's maybe for their job. So you may have something like on a career pathway, there are certain periods where for example, maybe a soldier, you have to be away for some years fighting. You can do some type of IVF procedures to be able to ensure that your family life can continue, your genetic line can continue, should in case something happens in the war front. So those are some of the indications why it may not be it definitely won't be the same for everybody who is coming in for IVF, but there has to be a cogent reason why that person is coming for an IVF procedure.